So, what is the difference between jitteriness and seizures in neonate? Jitteriness and seizures in neonate may appear similar because both involve abnormal movement, but they are distinct conditions with different causes and different characteristics. So, we talk about jitteriness first. So, jitteriness is often caused by benign non-pathological factors such as low blood sugar, or we call hypoglycemia, or because of mild withdrawal symptom in neonatal abstinence syndrome, or it just can be because of immature nervous system, can be due to hypothermia as well. So how it appears, it typically involves fine rhythmic tremors or shaking, usually affect the arms, the legs, and the chin. The movements are typically symmetric and are often triggered by stimuli lah. If you handle the baby when you examine, or you handle the baby during feeding. What about the duration? Usually the jitteriness resolve quickly with intervention if you feed them, for example for hypoglycemia, or address the underlying causes lah if you correct the hypothermia, for example. So what about the consciousness level during jittery? Usually jittery neonate are typically alert and responsive during that jittery episode, and the movement usually cease when the infant is held or comforted. So what about the seizures? Seizures usually cause from multiple causes such as brain injuries, infection, metabolic disturbances, or genetic condition. Neonatal seizures usually quite concerning because they usually indicate a serious problem. So, how the seizures appears in neonate? In general, seizures are often characterized by abnormal, repetitive, and involuntary movement or posturing lah. So this can involve rhythmic jerking, stiffening of the limbs, and abnormal eye movements. Seizure also can include the autonomic signs such as changes in heart rate or breathing. Okay, so what about the duration? So the duration of seizures usually it tend to last longer, and it may not stop with gentle handling. So the duration can last from few seconds to several minutes, and then the infant may remain unresponsive during that episode. Okay, so the key here, jittery, they are conscious. The seizures, they are unresponsive. So the consciousness level during the seizures, the neonate typically not conscious or aware. The baby may show sign of altered mental status, such as blank stare or unresponsiveness lah. I mean, if you try to flick over anything, they're not responsive. So basically, the main key difference, jitteriness is often benign and there is triggered by the external factors, while seizures are usually the sign of underlying neurological problem. Okay. So jitteriness also usually symmetric and can be relieved by interventions such as feeding or repositioning when you held the baby, while seizures tend to be more intense, more prolonged, and also there is changes in the autonomic function such as your heart rate as well, your blood pressure as well. Okay. And then those neonate with jitteriness, usually they are alert, and then those with seizures may appear unresponsive or also may have altered mental status. Alright.